All right. Well, again, good morning, everyone. Thanks for joining us for this webinar this morning, Applying an Economic Development Lens to Childcare. My name is Dion Thompson-Davily. I'm a program manager with the National Association of Development Organizations, and I'm pleased to be joined this morning by our two speakers. We have Jennifer Grant, the Chief Executive Officer at the Early Learning Coalition of Seminole County, as well as Luis Nieves Ruiz. Luis is the Director of Economic Development at the East Central Florida Regional Planning Council. Our speakers are going to share with you today their work on a report that quantified the economic impacts of childcare needs in Seminole County, Florida, as well as how that report helped to frame and elevate the issue with their partners. But before I turn it over to them to talk about this important work, I have a few housekeeping items. And just going to try my slides here. There we go. First, I have to note this webinar is brought to you by the Economic Development District Community of Practice, which is a research and peer learning initiative made possible through a cooperative agreement with the Economic Development Administration. They ask that I give this disclaimer that the statements, findings, conclusions, and recommendations shared here today are those of the participants, trainers, and authors, and do not necessarily reflect the views of the U.S. Economic Development Administration or the U.S. Department of Commerce. This webinar is part of a series of content that the Community of Practice is releasing about childcare and economic development. In December, we put out this report as well as 3 case studies. Each details the challenges involved in this space, as well as the ways that economic development districts and regional organizations in general can be and are involved in their communities in solving various childcare related challenges. All these materials are live on the NATO website. I'll leave a link in the chat as well as in the post-webinar email I'll send out to all registrants for this call today. That email will also have a link to the recording of this meeting and the slides that our participants share. This childcare initiative is a live effort. We're still interested in hearing stories, challenges, or ideas from you about childcare work in your regions. So if you are inclined to share, I'll leave my email in the chat and also, again, in that post-webinar follow-up email. I'd love to hear from you to continue this valuable discussion and to keep sharing resources with the community of regional organizations that we support. I think that the 200 or so people that registered for this webinar on the morning after a holiday is a sign of both how vital this subject is and how much interest there is in improving the delivery of childcare and the ways that regional organizations can support it. So please do reach out and share. Finally, control with my slides again. Finally, if you would like to hear more about NATO's future childcare work or any of our other programs, please sign up for our newsletter, NATO News. It has resources, events, and links of all kinds for the community of regional organizations around the country. And with that, I'll turn it over to Jennifer, who's going to share some context about her organization, the childcare challenge they have faced, and how partnering with ECF RPC on this study helps to clarify the economic impact of those challenges and shape the narrative in their community.
Thank you. I'm going to share some slides. I'm going to try and share some slides. There we go. Good morning, everyone. Thank you so much for having me here. It's really kind of exciting to have people that are not typically in the early learning space talking about this issue. Obviously, it's my bread and butter, and I've been working in this field for over 18 years. I mentioned I'm with the Early Learning Coalition of Seminole, and I just wanted to start a little bit about why early learning, just to frame the conversation a little bit. A couple of facts for you. 90% of a child's neural network, their brain architecture, is actually formed by the age of 5. That's before they enter the K through 12 educational system. And that means that those first 5 years of life are really critical in how their brain is developing for their future trajectory. One other fact I wanted to share is that children that enter kindergarten not ready, of those children that enter considered not ready for kindergarten, 75% of those children never catch up. That's really kind of scary to their typically prepared peers. So 75% never
Yeah.
catch up.
Mhm.
And so that's a little bit to frame the early learning space, but I'll tell you a little bit about how we handle early learning here in Seminole County. Um, I am the CEO, as mentioned, of the Early Learning Coalition of Seminole. Seminole County is kind of just north of Orange County in the center of the state. We are created through legislation. So the Early Learning Coalition is actually one of 30 in the state of Florida, all 67 counties. I just added some counties. All 67 counties in the state of Florida are covered by an early learning coalition. And we handle two main programs. One is voluntary pre-kindergarten. That's a state-funded program for 4-year-old children, getting them ready for kindergarten. And that's regardless of income. And then we have the school readiness. It's a subsidized childcare program. It's funded by the Federal Childcare Development Fund or Childcare Development Block Grant. So that's really the program that we want to talk about a little bit today. Under that program, we offer family support, developmental screening. In the last several years, we've provided vision and hearing screenings to children under 5, nearly 3,000 to 3,500 a year, making sure that those kids are on track and have the physical health as well as the education to be prepared. And then we contract with private providers. So we work with both the public school system, charter schools, faith-based educators, family daycare homes, legally operating. We contract with them if they'd like to offer these services. And we provide training and technical assistance to make sure that the quality of care is high in those centers so that all children get a good educational experience. A little bit about Seminole County. Luis has really good data, so I don't want to rain on this, but we have a little less than 500,000 families, individuals living in our county. We're considered the natural choice. So we're known both for our work-life balance, our public spaces, and our education system. We have a fantastic K through 12 system, and we have a wonderful community college that's very connected in the community. So a lot of
Jennifer,
individuals move here for that purpose.
Jennifer, if I could just break in for a second, we're hearing a couple comments in the chat that they're having trouble hearing your microphone. I don't know if
Okay,
you could maybe just adjust it a little.
let's see what I can do with that. Might be talking too fast as well. Let's see.
Is it easier to hear me this way?
I
Yeah,
can
girl. Get it, Jennifer.
That's better?
Yes.
Yes. Turn
Okay.
up.
I apologize. Thank you for letting me know. Hopefully this will be better. Sometimes you can never tell. A couple other pieces to share about Seminole County. 67%, as of 2024, 67% of the residents that live in Seminole County work outside the county. And I think that's important to know that we're kind of a bedroom community to our Orlando, Kissimmee, Sanford MSA. And so because we are unique, our local decision makers, our Seminole County decision makers, tend to not want to see data related to the whole MSA because they're very unique and in the way that they expend dollars and the way that they are working on offering a good quality of life in our county. And so because we have very unique areas, it was one of the reasons that we wanted to partner with the East Central Florida Regional Planning Council to pull together data that was specifically related to our county. In early learning, you'll hear a little more about this later, but there is a market failure. It is a private market of early learning, but the current system relies on private funding for most children. Families are looking to pay for themselves when they are earliest in their work life. Usually, when you're having the youngest children, you're usually newer in your career field and have not maximized your income at that point. 13% of families with one child under 5, they spend 13% of their income. So when you think about the other costs of living issues that we have going on in our community, spending 13% of your income for childcare for one child under 5, that can become exponentially more problematic when you have more than one child. The industry margins are very low. Childcare center owners are not becoming millionaires. The industry margins are extremely low. Labor in the industry is provided by women and disproportionately women of color. The low wages in the industry lead to very high turnover, which we know from brain research is not good for children to have multiple people coming in and out of their lives. And the industry also has some major liquidity constraints. For example, right now we pay almost 60 days past when they've provided the service. We pay the following month after they've provided services under that school readiness program. So it is a challenging industry. Some additional industry stressors when we undertook this project is that Florida is on a trajectory to have, by the end of this year, a minimum wage of $15 an hour, which turns into a fiscal cliff for those receiving subsidies. You make just a little bit too much to qualify for the supports that the school readiness program offers. The pandemic really accelerated that economic impact, and another issue is that there is a labor entry cost. In order to work in early learning in Florida, you have to take 40 to 45 hours of trainings, and you have to take and pass tests. Most of the time, the folks that are working in the industry, that's not paid for by the owner of the business. It's paid for by the practitioner, by the educator that is going into the industry. So you could go and make a latte somewhere, not have to pay to be trained, and be able to walk in. And during the pandemic, folks were making more in other types of service industries than they were in early care and education. And that continues to be a challenge. And having benefits is very uncommon in the industry. So again, those are economic stressors. COVID impact, I hate to continue to talk about this impact, but it really did exacerbate the issues for us. In our county alone, 24 providers closed or sold. Folks got out of the industry altogether. And that's continuing. In the last 2 weeks, I've had 3 businesses in our county contact me directly about selling or getting out of the industry. So that's not just a COVID era issue. Childcare workers weren't identified as essential workers. So when essential workers needed to go to work, they didn't have places necessarily to take their children because they were not considered essential workers. In our county, this was through surveys. 45% of the businesses didn't have enough enrollment to remain open more than 6 months. That was in April of 21. 90% of our providers surveyed were using personal credit cards, additional debt, or personal savings to cover their operational costs. 85% reported increased difficulties in recruiting and retaining qualified staff. I already mentioned that you could go in another type of service industry, easier entry and higher wages. On our economy in the state of Florida, the labor force participation decreases. Families decreased hours of work, or they took unpaid or paid leave, but they reduced productivity when these challenges with early learning occur. And the impact was most pronounced among 25 to 39-year-old females, mom age, high school education, and incomes below $50,000 per year. So we saw people say, if I can't get support and I can't find a reasonable cost place, I'm going to step out of the workforce. And we know that has economic impact as well. So our goals for this report, I will tell you that we're playing the long game. This is not an easy shift to change decision makers, funding, and it really does require folks that are not in our industry to understand these impacts. And so having an economic analysis of this impact really helps me say, I'm not just somebody who wants good things for kids, and not that that's not wrong, but if their parents don't have a great place to take their children, they become unstable employees. And we've seen that time and time again as the industry has challenges. So our goal was to provide this data for decision makers regarding the economic impact. This could trickle out through our entire community. We did share it with our board of directors. Our board of directors is in fact created in legislation. We're kind of a unique nonprofit. And they were charged with going to their circles of influence. We have a lot of support through the Florida Chamber in early learning. We shared it with community leaders, and I continue to do so as leaders come and go and issues ebb and flow in the community as far as priorities. We continue to share this report. Even though it's a little bit older now, it still does show the economic impact. And then with county and state level decision makers. Again, this is a long game. We're not going to have immediate change in how we view birth to five education, but it is a really, really important economic driver. And with that, I will pass things over to Luis. And I have to stop sharing.
Louisa, I think you might not have noticed that you're still on mute there.
Okay, everyone. So hopefully now you can all hear me well. And I'll go and I'll share my screen again. Okay. So again, hopefully everyone is hearing me. Again, my name is Luis Nieves Ruiz. I am the Director of Economic Development for the East Central Florida Regional Planning Council. I also serve currently as an adjunct instructor at the University of Central Florida's School of Public Administration. So I will start our presentations by saying a little more who we are. We are a council of governments located in Orlando, Florida. Our agency provides technical assistance to local governments and organizations located within our 8-county region, which you can see here. Let me see, wait, sorry. So when we can finally find the problem, you all heard what Jennifer talked about, the importance of quality childcare and early learning education. I will start this presentation by providing some other much needed economic context and geographic context. So my objective here is for you as an audience to have a better understanding of how to apply an economic development lens to childcare in your community. So according to most economic pundits, and this includes your armchair economists, which are a lot in this country, the economy is strictly defined by the principles of demand and supply. So the theory says that the economy will reach an equilibrium when these two axes meet in the middle. And at that point, the market is going to be supplying enough goods and services to meet the demands of consumers. However, this is not always the case. As Jennifer explains, the economy also suffers from market failures, and these are usually not discussed often. This is an economic situation characterized by an inefficient distribution of goods and services in a particular market. This is basically the case with childcare and early learning education in industry. In 2021, the U.S. Treasury Secretary Janet Yellen described the nation's childcare industry as a textbook example of a broken market. She stated that the market does not work for the caregivers, it does not work for the parents, and it does not work for the kids. So how this translates on the real world? Well, families often struggle to pay for quality childcare. My number is actually a little higher than Jennifer's. Based on my research, upward 25% of their family's income can be spent sometimes on like childcare only. Meanwhile, child facility often struggles to stay open because of the cost. Staff turnover is also high because of the low salaries that are paid to childcare workers. And there's definitely a lot of issues with closures and capacity. And I guess I should share a quick story here to provide you some context why a single guy will be so interested in childcare. Well, for 12 years, I actually mentored a kid to Big Brothers Big Sisters of Central Florida. And out of those 12 years, I would say about 8 of those years, his mom was raising 3 kids working for childcare facilities. So I definitely understand the struggle that some of these workers suffer, which makes it even more important because if I want a better quality of life for my little brother, who's now 25, he just turned 25. But if I want a better quality of life for those kids, I have to make sure that the parents are earning enough money. So one example of this case is our case study, which is Seminole County. And I want to provide you some context because Jennifer provided some really good information, but she didn't talk about what I'm going to be saying today. So Seminole, when I compared it with my other counties in the region, is the wealthiest county of all of them. We're talking that the median household income is just a little over $83,000 a year, which is well above the state and national average. Seminole is also very white. And in my region, I have at least 2 counties that are majority counties. So you understand the situation. So the median age is 39.8, which is also slightly higher than other counties in the Atlanta metro area. What I want to give you that context is that if I have done this analysis in some other more counties like Orange or Osceola, my results will have been even much more higher than they're here. So I want to give you that. So despite these demographics, which we know is where they're wealthier, Seminole still shows a shortage of childcare facilities. With many of them closing in the past 5 years, I'm glad that Jennifer brought the numbers because if you see the map here, we tried to do a map showing where the childcare facilities were located, and we also show the capacity, which is like how large the circles were. It was really funny because we did this analysis, and then Jennifer told us that about 10% or 15% of those facilities are already closed. So it was really interesting to understand the problem. But when you look at the demographic and you look at the census, you have to understand that at the point we did this study, the American Community Survey said that Seminole County had more than 25,000 children between the ages of 0 and 4. But when you look at the capacity of these childcare facilities, they only had capacity for approximately 12,000 children. That's less than half. So this is a mismatch that is definitely going to be a barrier for full workforce participation and will continue to influence the county's overall economic performance. The idea here, we already know that Seminole County is doing really, really well economically. But could it be doing better if we address this barrier? That's the real question here. So the objective of this project was basically to estimate the value of the childcare and early learning coalition learning industry to the county's economy. And to do this, we used the REMI policy insight model to develop a series of economic impact simulations. For those of you that are not familiar with this methodology, economic impact analysis modeling helps measure the effects that one-time events or policy changes can have on a region's economy. This type of analysis traces spending through the regional economy and measures the cumulative effect of that spending. As a modeler, my main role is to develop credible variables that could be entered into the model to generate these results. So that's where I come in. So today I will be discussing 2 of the simulations that we prepared for this project. One was an economic valuation analysis, and the second was the gradual loss of childcare workers. So the purpose of the valuation simulation is basically to quantify the financial impact of a particular industry. This is also referred to as an economic footprint analysis. In plain English, we're asking the model to tell us what this industry is worth to the region's economy. When developing this simulation, I had to make several assumptions. The first one was that childcare is crucial to maintaining a healthy level of workforce participation. If a parent lacks childcare, then he or she just can't work. That's the reality. Somebody has to keep watching that kid. Therefore, the first step of this process was to identify the number of households that were most dependent on childcare services. My source for this information was the American Community Survey. When looking at families with children, The census categorizes those that have children under 6 and those that have children between the ages of 6 and 17. So then families are going to be divided into two main categories. There's the single parent, which is in green here, and the two-parent household, which is in blue. When adding these two categories, we came to a total of over 1,400 households in Seminole County. However, it's very important to know that some parents may be staying home by choice. And that's understand this is a wealthier county. To account for this phenomenon, I look at the number of women between the ages of 20 and 39 that were not currently in the labor force. These age cohorts represent about 18% of all the women not in the labor force. Because what I did, I subtracted this number to get the final number of households that are most dependent on childcare. So the simulation was basically taking these 12,343 workers out of the county's economy. So what I did was I entered a number of workers in the REMI-PI model to estimate the value of childcare. The economic impact, we use 4 main indicators. One is employment. We also have output or sales, personal income, and gross domestic product. So according to REMI, Seminole County's childcare industry supports close to 26,000 jobs. This number is going to represent over 8% of all the county's employment. It is comprised of the direct jobs, that 12,343 jobs we took away from the economy. They're held by parents dependent on private childcare facilities, and an additional 13,628 indirect and induced positions. This employment estimate is going to include both full-time, part-time, temporary positions, and the model just gives an equal weight. This is not going to make a difference, and that's important for you to know. This output is basically sometimes referred to as total sales volume. It measures the gross level of business revenue, which can include both the cost of labor and materials, which is your intermediate outputs, and then that value-added activity, which is the compensation and the profits. Since the business output is the broadest measure of economic activity, it basically tends to generate the largest numbers. So anytime you see one of these simulations, some people point out the output. Well, output is not the best measure of the impact. It's just because output measures everything. But here, what we saw is that basically when those jobs were taken out, we had about $3.6 billion of the county's output that basically just disappeared. So you can basically state that yes, this childcare basically contributes about $3.6 billion to the county's output. Seminole County residents also gain close to $2.9 billion in personal income because of the childcare sector. This is going to include both the earnings from the employee compensation, any wage supplements, rents, transfer payments, and other business ventures. Finally, the most important indicator is what is called the gross regional product. Sometimes we refer to this as the gross domestic product. This is actually what we do nationally is GDP. So this figure is going to represent the market value of all services produced by labor and property. And what happens here is that your output is going to include everything. So here is going to be your more value-added activity. It's what you're actually gonna really earn. So REMI basically said that the childcare sector in Seminole County contributes more than $2.1 billion to the county's economy. So the goal of the second simulation was to basically estimate the long-term impact of the loss of childcare workers. Jennifer kind of referenced that. So I'm just going to delve a little in some of the assumptions that I made. So as I explained previously, there's a lot of attrition in this market because of the low salaries paid to the workers. I look at some numbers in the Orlando metro area, according to Own It. The median salary for a childcare worker is close to $30,000 a year. This could easily, depending on number of hours, between $13 and $15 an hour. So I want to put this in perspective. So the startup salary, if you want to basically go to work for a theme park like Disney or Universal, is $18 an hour right now. That's your starting salary, which is significantly higher. Therefore, the assumption here is that this turnover rate, because of the competition, was going to accelerate in the upcoming years, especially with the changes to Florida's minimum wage law. At the same time, the recruitment will become much more difficult, which will affect the capacity of the sector to serve local workers. So based on several sources, the ECFRPC estimated that there are about 2,200 early learning workers in Seminole County. The ECFRPC used a 21.1% attrition rate. This was developed by the Minnesota Federal Reserve, and we use this to reduce the number of workers on the annual REMI forecast. We then use the state's child-adult worker ratio from the state of Florida and the county's average family size to estimate the number of families that could be affected by the decrease in service capacity. Based on the previous numbers, we determined that about 5,800 children could be affected annually, which this means that approximately an average of 2,300 residents could be forced out of the labor force because of the unavailability of childcare. This, in the end, will easily result in a loss of about 4,800 employees countywide. This reduction will also result in a decrease in about 672.1 million in the county's output and 537.6 million in personal income. The county's gross domestic product will be lower by about 404.6 million. So it is important to know that all these numbers, because I had to do, it wasn't an annual it was more like an annual forecast. The numbers that I'm telling you are reported as averages. So there's some years where it could be higher or lower than this. So to conclude my presentation, I would like to reiterate that both simulations show the critical link between childcare availability and economic development. If this is not addressed, the problem is going to get worse. And I'm going to give you an example. My team recently completed the economic strategic plan for the city of Titusville in Brevard County, a whole different county on the coast. So despite having a thriving space economy, companies there, and paying very high wages, by the way, companies there are complaining about the lack of workers. So during our study, we actually found that the city's labor participation rate is much lower than the national rate. And what you have to ask yourself, even if it's not the main factor, could the lack of affordable childcare be contributing to this situation? This was definitely, we have a series of focus groups during our work with the business community, and childcare was definitely mentioned as one of the issues that some of the parents were facing. And for me, when I look at this, you cannot really take a chance if you know your employers are cannibalizing each other to find new workers. You have to make sure that everybody who's able to be in the workforce is in the workforce. And this includes the parents that are taking care of these children. So based on my research, I'm not sure that there is a local answer to the affordability crisis with childcare. I think that what Jennifer is saying, we're going to the state and we're going to the federal government showing this type of study to help them pay more attention and understanding that our economy may not be performing at its maximum because we are not taking care of the nation's children. So this is the end of my presentation. I'm gonna basically hit escape and then we can go in and stop sharing. And I guess we can go into questions.
I did see one question in here that I appreciate. Does childcare include daycare? And that's a really good question. In my world, I try to use early care and education because birth to 5, any out of home care falls into that category. There are licensed providers. There are marketing bents. So some people call it a preschool or an early learning academy. Some of that is marketing. But as far as those that we're supporting, we're talking about out-of-home care that's legally operating. So yes, they are kind of the same thing in this particular industry. Part of our challenge is trying to get people to change their mentality because brain research tells us that daycare or childcare terminology doesn't show the importance of the brain architecture and what's happening with children between birth and 5. It truly is educational opportunities through experiential learning.
As an
Thanks
economic
for that
development
question.
person, I had to actually learn and be corrected. Even though it's longer for me, especially with the accent, it gets a little harder. But I say childcare and early learning education every time I'm able to speak, is I've been corrected several times by some of our by people like Jennifer about, and it speaks about the complexity of what we're talking about. It's not
Yes.
only about, hey, where I'm gonna be leaving my kids. It's somehow more about, am I getting my kids ready to get to school, or I'm getting my kids ready to be successful in the workforce?
Right.
Well, if anyone has any questions they'd like to ask the speakers directly, feel free to come off mute, or you can leave them in the chat if you're more comfortable there.
I feel like we really excellently demonstrated, the issue in what we're seeing. And I think, obviously this is Florida. I'm in Northeast Oklahoma. These issues are echoed here and I think nationwide. Um, I would be very interested to hear about what are some tangible practices that you've seen happen within your communities to work towards alleviating some of these. Obviously, they're never going to be fully gone, but what improvements have you seen and what steps led them there?
I think for me, like I mentioned, this is very much a long game, and it's not something that just early learning practitioners can solve. So having chambers, having economic development organizations understanding this impact to come together to look at how we can solve this issue, and understanding that throwing money at a problem alone is not something that we can necessarily just do to solve it. Of course, that's always the bottom line. But we did have some legislators pass a tax incentive for businesses to fund early learning, either through kind of a benefits option for their employees or to start an on-site early learning center. That's something we haven't seen a lot of movement on it. We're still trying to learn how to help businesses interpret that tax benefit. But that was something that our legislators did in Florida, not as a result of just this information, but it was something that they put into law with lots of stakeholders being engaged in this issue. That's just one thing that I can think of off the top of my head.
Yeah, Jennifer, I
Um,
would add to that that something that I've learned in conversations with economic development districts is that this is an area that the business community is interested in being engaged in more so than some of the other issues that these organizations might work on, because of course they have that economic interest. They want their workers to be able to come to work, and so as a regional organization, you likely already have those links to the broader business community, and this is just a great place to pull them in to work on various solutions, whether that is planning where we are now, or there's a specific program. I know in some states there are various like nonprofit childcare operators that can use sponsorship or other things like that. But just the business community is great to engage here to answer the audience question there. Another question that we have is from Spencer in the chat. Given this is a failure of the private market, what actions can local level decision makers and government entities take to address the issue?
On my side, what we recommended Titusville, and again, like I said before in my speech, I think that this is not much of a local level type. There's not much you can do, sadly. But one thing that we can do, especially if us people like me, our planners, and it's something we recommended to the city, was to make sure that we basically got rid of some of the barriers to the establishment of childcare centers. There are people that there's still some demand here. There are people who are pretty coming in and they need to leave their children. But if you're gonna basically use zoning and fisher land use to basically curtail the establishment of these sectors, they do bring traffic. That's a reality. They do because the parents are leaving their children. But if you can look at those barriers at the local level and analyze and say, well, is there something here that I can do so my regulations are not so difficult on the establishment of these facilities? At least you help establish some sort of like offer or supply in your local market. I don't know, Jennifer, you had something you want to say?
I was also thinking that federal fund, the Child Care Development Block Grant, in Florida, we have a dollar for dollar match. So I get money from our local county government they give me a dollar so that I can draw down an additional dollar for that. So local investment right now for us from other nonprofit entities like partnering with United Ways, with our local city and county governments, those dollars seem to be shrinking, which even means the pot for that subsidy gets smaller and smaller. And so that's one of the things that we're looking at. We're also looking at how to encourage participation. So our legislature changed the level of entry into that subsidy program so that school readiness families could make a little bit more. They've tied it to our state income now. So that was another win last year, that as the state income increases, that the entry into that school readiness program could move economically as wages increased. And so that was another win. So just a couple of other things that locally and statewide that we've been doing to try and address the challenges. And I will definitely look for the tax incentive issue and see if I can get that to Dion so you can share that out with the group as well.
Do we have any more questions from the audience? Okay, well, we won't hold you. I want to thank everyone for attending this webinar this morning, and I want to thank our speakers, especially Jennifer and Luis. As I noted at the top, we will go ahead and get the recording and slides sent out as soon as we can, as well as any of the other follow-up information that we mentioned. Please, if you can fill out the quick survey that you'll get in your browser as you close this call, we would really appreciate that. And otherwise, have a great Tuesday. Enjoy the rest of your week. Thank you.
Thank you, everyone.
Thank you.